Thank you for listening to Here's to Your Health, a podcast brought to you by the Crawford County Memorial Hospital. During this podcast, we talk about healthcare, the people behind it, and the opportunities that help shape the next generation of medical professionals. This podcast is where we share stories, insights, and conversations focused on healthcare and the people who make a difference in our community. Thanks for listening to the Here's to Your Health podcast. I'm Jill Melby, and today we are here with Dustin Durbin to talk about our volunteering programs here at CCMH. Dustin, can you tell us a little bit about your role at the hospital?
Yes, well, thank you for having me on your podcast today, Jill. I am Dustin Durbin. I'm the volunteer coordinator here at the hospital. My role is kind of a little bit of everything volunteer, from our transportation program, our patient partners program, our Project Harmony volunteers, our SHIP volunteers, and a little help with setup and takedown for the Bloodmobile via LifeServe.
Very good. You do a lot here at the hospital and in our community. So can you tell us a little bit more about the Patient Partners Program?
Oh yes, this is a new program that was rolled out earlier this year of 2025, and it is our volunteers come in and visit patients on the floor. It started out being our skilled care patients, ones where they aren't able to go back to their home right away after their surgery, so they might have to stay here for a long period of time, whether it be from 3 weeks to maybe up to even 6 to 9 weeks. And so a lot of times it can be just a little lonely sometimes if patients don't have families that come to visit. So this is just a great way just to sit down, talk with our patients, and it's also a great way, I think, for our own mental health sake. I think it really helps just us all be kind human beings. And also you can play cards and checkers or do some coloring if that's what you like to do.
So why is the Patient Partners Program so important to CCMH and the patients here?
What's the best thing about that, why it is so important for us, is it builds community trust, I feel. It's something where, that, again, it goes back to, you don't have to feel alone. Like, you're not doing your ailment alone. You're actually doing it as a community, and most of the times a lot of our volunteers and the patients, sometimes they know each other, so there's that common bond that they get to build. So it's really, again, I always say mental health because it's just so refreshing just to have somebody different to talk to each day.
So it sounds like both get something out of it, the volunteer and the patient.
Yes.
So who's a good fit for the Patient Partners Program if they're looking to volunteer?
I would say anyone that likes to just talk to people, conversate. There's different topics that you can get on. We have, if you're, we have a broad horizon of different patients. You might have guys that like to talk about cars and tractors. You might get ladies that like to talk about food and knitting and anything from the soap operas to just pretty much anything that's out there. A lot of times I think there was one lady I was watching the Today Show and was just so intrigued by the celebrity personalities on there that it's just interesting to build that bond.
Very good. So it sounds like maybe anyone can do this. Like if I wanted to volunteer, I don't have any healthcare experience. My experience is marketing. So, would I be able to volunteer? Would I be a good fit, or would I need to take a class or a training to do this?
Oh no, it's a great fit. The only training that we really have right now is, so this was actually stemmed by Gracewell, and so they actually have their activities director that comes down on Mondays and Thursdays, and this is just a great way. So our training is to just kind of sit in and see what's kind of done for them. Mm-hmm. For them, it's just kind of just making sure everything's on track for them. They get kind of a little bit more in depth, which is okay. I don't expect that from the volunteer, so they're asking more like cognitive questions, and then they kind of just get on topics. One of the patients was a gardener, and so that was a really great conversation. So that's part of the training is just seeing what kind of conversations you can get into, and if knowing that they're going to be patients that staying longer, you really get to know their likes. And there's nothing against anyone if you want to bring in some magazines about gardening. In that example, you're welcome to do so. Like, if it's something that you both share a common bond with, go for it. There's a lot of patients that they just like to sit and talk about their families. I've had volunteers, they'll sit and watch the Game Show Network, and they just have fun doing that and just talking while they're watching that. So don't ever worry about there being a dull moment in conversation. You're always going to find something to talk about.
That's great. So if I wanted to volunteer, if someone's listening and wants to volunteer, how much time is required for the Patient Partners Program, and how flexible is the schedule?
The schedule is it's pretty flexible. So how it works right now is we have you come in about 10:45, and you'll stay till about 1 or 2 possibly. But that's not, it doesn't always have to be that way. If that time doesn't work for you and you want to come in a little bit later, you're welcome to. So you can really come in anytime. A lot of the things that I've noticed is, so we have physical therapy usually kind of does right after lunch. So it's not always the best time, but I would say anywhere between 2, 3, and 4 would be great times to come in. If you're looking for a little bit earlier, I always try to stay away from the 8 and 9 o'clock hour, so I would say anytime after 9:30, 10 o'clock would be a perfect time to start coming in. Reason why 9 o'clock is doctors and nurses are doing their roundings with the patients, and so that's just kind of like that little gray area where we make sure the patient and the doctor get to have their conversations.
Yeah, that's very understandable. Just working around the patient's schedule and your schedule to kind of make it match.
Oh, yes.
If someone's interested in volunteering, how do they get started here at CCMH?
Well, there's a couple different ways here. You can either go out to the website and go to the About Us page, and there's a page called Volunteer Services, and then the application's there to apply. If you've got questions or want to, you are welcome to reach me at 712-265-2520. Or I'm also, if emailing is your preferred method, I am at ddurbin@ccmhia.com.
Perfect. So just one last question for you, Dustin. If there is one thing you wish everyone in our community knew about the Patient Partners Program, what would that be?
You're going to laugh, and I'm going to take this from one of our current volunteers. There is a free meal involved in this.
That's great.
But actually, for the most positive thing that is out there is just the rewarding portion of, at the end of the day, what I love hearing from volunteers that we don't ever, sometimes we don't get to hear sometimes, is how much fun they had just visiting with the patient. So that's what's going to be the most rewarding.
That's great, and I think everyone would feel good about that. Well, thank you for coming on to the Here's to Your Health podcast with us today, Dustin. And then if anyone is interested in volunteering, I'll have you repeat your contact information.
Oh, yes. You can reach me at, phone number is 712-265-2520, or you can reach me via email at ddurbin@ccmhia.com.
Thank you.
Thank you.
Thank you for listening to Here's to Your Health, a podcast brought to you by Crawford County Memorial Hospital. We hope today's episode provided helpful information and a better understanding of the care and services available in our community. Be sure to join us next time for another conversation on Here's to Your Health.